Postural orthostatic tachycardia syndrome is a very serious disorder that affects and changes the lives of people every day. What would you do if one day your life got turned upside down? Say you're a high school student that plays sports all year round until suddenly you start getting a plethora of unwanted and unrelated symptoms. You go to doctors upon doctors, but you never get any answers, until finally one doctor mentions that you may have postural orthostatic tachycardia syndrome. Dr. David Robertson, an endocrinologist, estimated in 2006 that 500,000 Americans have it. Dr. Philip R. Fisher of Mayo Clinic in Minnesota later estimated that every 1 in 100 teens develops it. The ability to just stand up without thinking, or for our bodies to function normally, is something that we take for granted every day. High school, college, having a job, and having a family can be difficult enough on its own, but imagine having an illness to go along with this. Sometimes it can be nearly impossible. Think about how this would affect you and your family. I played 3 sports in junior high until one night I started having heart palpitations. I was diagnosed with supraventricular tachycardia, and I had to have 4 cardiac surgeries. After a year and a half of various symptoms, I had to have a tilt table test, and I was eventually diagnosed with postural orthostatic tachycardia syndrome. 8 years later, it is still something I struggle with every day. POTS is a potentially debilitating disorder that can come about suddenly and change someone's life completely. It affects mainly teenagers and adults, and there is no cure. I will be explaining what it is, what it does, and treatment options. First, I will talk about what it is. The most effective way to understand what POTS is to first learn about dysautonomia and the role the autonomic nervous system plays. The autonomic nervous system is made up of 2 divisions. The sympathetic division, also known as the fight or flight system, and the parasympathetic division, also known as the rest and digest system. The autonomic nervous system as a whole is essential for the body to maintain homeostasis. The endocrine and metabolic systems also work with the autonomic nervous system to do this. In a patient with POTS, the autonomic nervous system does not work correctly. The autonomic nervous system is supposed to regulate bodily functions such as blood pressure, breathing rate, and heart rate, among others, without us thinking about it. These are automatic functions that just happen normally in someone that does not have something like POTS. Dysautonomia literally means dysfunction of the autonomic nervous system. This is an umbrella term, as Dysautonomia International words it, that is used to describe a few conditions that have this dysfunction in common. In someone that has POTS, something as simple as the heart beating normally at rest can be a problem. In most cases, the heart speeds up even if someone is lying down, doing nothing. Dysautonomia International describes this well. They explain it as people living with various forms of dysautonomia have trouble regulating these symptoms. And that's very true. Diagnosing POTS can be difficult because many doctors are uneducated about it, and each patient has different symptoms that are prominent. Anyone can develop POTS, but doctors have noted that it does affect women between the ages of 15 to 50 years old the most. According to Dr. Blair Grubb in his book, The Fainting Phenomenon, women are about 5 times more likely to develop this than men. From personal experience, a lot of doctors think that a teenager complaining about having all different kinds of symptoms such as excessive fatigue, fainting, and not being able to concentrate suddenly is just looking for attention. It takes a truly great doctor to listen and take action, and a pushy patient and family that will not stop until they get answers. To officially be diagnosed, one must go through a tilt table test. During this, electrodes are attached to the patient's arms, legs, and chest to monitor their heart rate throughout the test. A blood pressure cuff is placed on a finger, arm, or both to monitor their blood pressure at certain points, and sometimes an IV line is placed into a vein. The patient lies down flat on the table and is strapped down to prevent slipping. The blood pressure and heart rate of the individual are monitored while laying flat and then at different angles until reaching 90 degrees, where he or she will stay for up to 20 minutes if they can without fainting. During my test, I also had to do breathing exercises at each angle. After being diagnosed, many patients try to find the underlying reason for developing POTS. In my case, My doctor thought that the trauma on my body from having 4 heart surgeries within 8 months when I was only 13 and 14 caused it to come out. My doctor also told me that I had the gene for it, as a lot of people do, but it takes something traumatic on the body, an illness, or even giving birth for it to come out. Many POTS patients develop other disorders that seem to go with it also. Some of these disorders include gastroparesis, chronic fatigue syndrome, and joint hypermobility syndrome. Similar to the symptoms, this varies with the person and depends on how severe their POTS is. So how does someone's life change when they are diagnosed? In most cases, the symptoms of POTS become much worse before they get any better, and new symptoms present themselves quite quickly. Patients' lives and their families are impacted greatly, and adjustments need to be made. At first, the patient's symptoms may be getting dizzy when standing, being extremely tired all the time, and not being able to go out and do things he or she normally would, such as shop, work, or go to school for a long period of time. This may put stress not only on the patient, but on family and friends. In a person that eventually has severe POTS, the list of symptoms could be an informational speech on its own. But more that may happen include generalized weakness, chest pain, tremulousness, excessive sweating, blood pooling in the legs, migraines, nausea, tunnel vision, and brain fog. The most common symptom for many is an increased heart rate of 30 beats per minute when standing, and their blood pressure lowering quickly. Having a support system is extremely important during this time. The POTS patients can feel okay one day and be bedridden the next. There's absolutely no pattern. POTS can slowly or quickly get worse. The person with this disorder and those close to him or her will most likely get frustrated, but it is necessary to stay positive, be patient, and take advantage of all the good days. Someone with this syndrome must prepare for the emotional stress that comes with it. A little known fact that my doctor told me is that some people that are diagnosed with ADHD actually don't have it. They have postural orthostatic tachycardia syndrome, and it's a real mistake that happens. But in those people, the loss of concentration and focusing is more prominent. It can be guessed that this symptom is quite frustrating because a POTS patient's grades may quickly begin to fall if they are in school. If symptoms such as syncope, which is a medical term for fainting, or chronic fatigue develop, he or she may not be able to go to school at all. To a student that takes pride in their academics, this can take an emotional toll. Along with grades slipping, this person will most likely lose some of their friends also because they won't understand or they won't want to. Many patients resort to homeschooling or tutoring when they are not able to go to school. I was placed on a 504 plan, and I went to school when I could. I was also able to use an electric scooter for the days that I couldn't really walk. Different tutors came to my house when I was not able to do much, and to my knowledge, this seemed to work pretty well. After high school or as an adult with a job, this disorder proves to be difficult in perhaps different ways. The social life still suffers, however. Some patients are able to go away to college, many though are not, and stay at home and go to a community college part-time. In the workplace, someone with POTS may be forced to work part-time or eventually not at all. There are a number of patients that are on full disability. If they are able to work, though, adjustments may need to be made, such as sitting more or working hours that correlate with when their body functions the best. Now that I have explained what POTS is and the impacts it can have, I will talk about my last main point that is more positive: treatment options. Even though there is no cure, there are ways to manage the disorder and even make some of the symptoms stop. Usually the first step in trying to treat the symptoms is medication. This can be a challenge though because again, everyone has different symptoms and sensitivities to medications are common. Medications to control tachycardia are almost always used. These are chosen based on the type of tachycardia and any other disorders that the person may have. A couple examples of medications used frequently are antidepressants such as Cymbalta to help with muscle and joint pain, and fluorocortisone to raise blood pressure. There are all sorts of medications used to help other symptoms though, such as digestive issues, insomnia, fatigue, low blood volume, and lack of concentration. In many cases, it takes trial and error to find one medication or many that work together to help with symptoms. Sometimes, medications do make symptoms worse. Non-pharmaceutical remedies and exercising can help tremendously also. Simple things such as eating small meals frequently throughout the day, cooling vests, compression leggings, or elevating the head when you sleep have proven to aid in alleviating symptoms. Drinking more hydrating fluids, or even getting saline through an IV, and increasing salt intake has been one of the most effective short-term solutions for all of those with POTS. Staying hydrated is key. Some have turned to acupuncture, yoga, or Reiki to focus on certain symptoms. I have gone to acupuncture for about 5 years now, and it has helped with a lot of my symptoms such as chest pain, circulation issues, and muscle and joint pain. Although most people with this disorder are exercise intolerant, it is still important to keep moving in some way. Dr. Blair Grubb, who I personally see, has found that slowly building up tolerance on a recumbent bike and using a rowing machine is quite beneficial. Swimming is also great because in water you are weightless, the blood in the body is distributed evenly, and it is a form of cardio. In the long run, any exercises that build up strength in some way, even if it is exercising from your bed, will lead someone with POTS in the right direction. I hope that through this presentation you have gained knowledge on this peculiar disorder. Postural orthostatic tachycardia syndrome, as I mentioned previously, is not well known, and because of this, I also hope that this presentation raised awareness. If even a few more people start talking about it, eventually it will become well known amongst a greater number of individuals, and more research can be done to find better ways of managing it or someday cure it.